created a health equity and social justice work group, which are doing great things. We had our LCME site visit, and the site visitor said the great strength of Downstate is its diversity and inclusivity programs and its work on health equity and social justice. Everyone that won awards today, so Christina, Shirley, Nika Ruka, Sandra, let's see, I'm trying to hang on. Laura, Simone, Laurie, and Carol, and Taryn are to be congratulated for their outstanding work in diversity. It's a team effort, and I know you have President Riley and my full support to continue this work and make lasting change. So I want to congratulate all the award winners. I'm so proud of all of you, and I want to thank you for your dedication to Downstate.
Thank you.
Thank you, Dean Brunacardi.
Thank you so much, Dean Brunacardi. We really appreciate that. Okay, so I'm going to go ahead and get started. Welcome, everyone. This is the 4th annual Dr. Dale Blackstock Women's History Month Lecture and Awards Ceremony. So I'm very happy to have all of you here. Dr. Booten Foster is here as well, who is the Associate Dean for Diversity, Education, and Research. If you'd like to say a few words, feel free.
No, well, thank you, Dr. Janza Saze, for organizing this. And as Dean Brunacardi said, health equity and social justice, diversity, equity, and inclusion is part of our core fabric, and that's what makes SUNY Downstate unique. And I am truly proud and blessed to be a part of the SUNY Downstate family. And we're committed to growing and as Dr. Brunacardi, Dean Brunacardi likes to say, the next level of excellence. And we truly believe that through community engagement, outreach, diversity, equity, and social justice, we will definitely further reach that next level of excellence. So without further ado, thank you again, Dr. Janza Saze, and all of the members of our office, Ms. Tina J, Mr. Renaka Goldstone, Ms. Shamika Bowman, for really making this happening and keeping us connected, though we are distant. So thank you.
Thank you so much. So first, I'd like to just talk about who Dr. Dale Blackstock was and why we decided to name this series after her. So Dr. Dale Gloria Blackstock, a beloved daughter of Brooklyn, who despite or maybe because of her beginnings, possessed the ambition and resilience to excel as a physician, teacher, mentor, mother, sister, and wife. She arrived in this world in 1950 to circumstances that make any level of future success seem unlikely. For her single mother who raised her and her 5 siblings on public assistance was resourceful and determined. Despite struggling to make ends meet, her mother always emphasized the importance of intellectual curiosity, which rubbed off on Dale in helping to broaden her horizons through books and the written word. After graduating from medical school, she completed her internal medicine residency at Harlem Hospital, and her first job out of fellowship was at Kings County and SUNY Downstate, where she spent the bulk of her career. As an attending physician, she took great pride in providing.
I'm sorry, I was just listening to something. What happened?
Can everyone mute, please?
Can we do it?
Can we go and get
Yes. She took great pride in providing clinical care in the same community in which she was raised and involved in advocacy and initiatives that bridged the medical center and the community it served. What she cherished most, however, was the opportunity to teach and mentor residents and students. She was active in DHW, the Daniel Hill Williams Society, the Provident Clinical Society, and the Dr. Susan Smith McKinney Stewart Society, named after the first Black woman to earn a medical doctorate in New York State, as well as her membership in the AWMA, the American Women's Medical Association. Dr. Dale Blackstock was always eager to continue intellectual growth, and later in her career became board certified in geriatrics, and her position was as a medical doctor at Village Nursing Home in Manhattan. At only 40 years of age, she was diagnosed with a rare form of leukemia, and despite being told she had a month to live, she survived for 9 months after her diagnosis, a testament to her grit and fortitude that she carried with her from her early days. and the reason why she is always a woman who would overcome the tremendous odds against her. Her daughters, Oni and Uche, have continued in her footsteps throughout their work as physicians and mentors. And what I will say is they are rock stars in their own right. And we're so proud to have them here with us today. I'd like to share other photos we have of Dr. Dale Blackstock doing what she loved most, which was giving presentations and teaching students. And at the bottom, you'll see an image of her with her beautiful and dynamic daughters. And I'd like to open the floor for them to be able to say some words for us today.
So thank you so much to Dr. Daniels Asaze and Dr. Booten Foster and the Diversity Education and Research Office for this continued recognition of our mother's contributions to the SUNY Downstate community, where she spent so many years of her career. I think, for Uche and I, it's so heartening to be reminded that we're not the only ones who remember her impact, and that there's so many others whose lives she touched. She cared very deeply about her work as a physician, as an educator, as a mentor. And it was especially important to her to support other women, especially other Black women like herself, because she knew the barriers that women had to overcome in medicine. Our mother would have been 70 years old today, and it's really hard to, not today, but she would have been 70. And it's really hard to imagine, like 25 years have passed since she passed away. She accomplished so much in her short life. It's almost as if she knew, or the universe knew, that she didn't have as much time here. So she packed it all in to her brief life, but her spirit, her essence, and fortunately her legacy remains. And I just wanted to say, when I was looking for pictures to give Dr. Daniels Asaze, I came across some flyers from some of the educational outreach that she did with Provident Clinical Society. And actually that picture may be from one of the outreach activities where they went into the community to do lectures on high blood pressure and cancer screening. And she even saved the audience evaluations that she got from these activities. It was just so meaningful for her to do work where she engaged with the community. And she really married her love of medicine with advocacy for her community, and was really doing health equity before it became in vogue. So much of what she did has inspired Uche and I in terms of our work around equity and justice. And I just want to congratulate all of the awardees again for all of your accomplishments. And again, thanking the Office of Diversity, Education, and Research for continuing to recognize and remember our mother's legacy. Thank you so much.
Oh, you're so very welcome. Dr. Uche?
Oh, I have nothing to add. Oni said it perfectly. Just thank you for remembering our mother, for recognizing her accomplishments, and congratulations to today's awardees.
Thank you. And I want to also add that I had the pleasure of attending elementary school with both Oni and Uche. So we have our own photos of us back in the day with our red uniforms from St. Mark's Episcopalian School years ago. So I'm glad that we were able to continue to connect with each other. So thank you so much for being here. And we are honored to be able to continue your mother's legacy. So today we wanted to start off with our keynote speaker. We always have a lecture first, and then we do our award ceremony. So we are blessed to have Dr. Christina Pardo with us. Dr. Pardo is a first-generation Haitian American raised in New York. She attended Howard University as a pre-medical student and became actively involved in social and disparity issues in underserved communities. She graduated with honors with her BS in biology in 2004, and then graduated from Rutgers Robert Wood Johnson Medical School in New Jersey. She also completed a master's in public health and international health at Boston University. Passionate about women's health, she decided to pursue a career in obstetrics and gynecology. Her desire to work with and for the underserved and immigrant populations led her to do her residency at SUNY Downstate. Throughout her education and training, she has traveled to Haiti to work with various health-based organizations. Within global health, she has focused on medical education and training and created opportunities for students and residents. She has served as a visiting professor with Equal Health and Hospital Universitario de Mirabales. I hope I said that correctly. I apologize if I didn't. Most recently, she has worked on the SUNY and Kellogg Foundation multi-sector community development project in Arcahaie, Haiti, and serves on the board of directors for Capra Care and Medinova, who both work in Haiti. Her interest in health disparities and social determinants of health and equity have led her to serve at SUNY Downstate as an assistant professor in obstetrics and gynecology, where she is the director of global women's health and social obstetrics and gynecology. At this point, I would like to welcome Dr. Christina Pardo.
Hi, thank you very much for that introduction. Of course, first, congratulations to all of the honorees. I will say it's just slight pressure, a little bit of pressure to be given this honor of giving this lecture to so many people that I admire and aspire to accomplish what they have, and the Drs. Blackstock, who I, of course, stan on Twitter and follow them and continue to learn from them. So, I was asked to do a presentation in Caribbean women's health, and we'll try to do a brief lecture because I know we all are zoomed out all day, so we can get to the presentations. So of course, as stated, I'm in the Department of Obstetrics and Gynecology because I want to make sure I thank not just our institutional leadership for hosting and having these type of work, but also my department, which is very supportive now with our chair, Dr. Camille Claire, and our previous leadership, Dr. Howard Minkoff, that really supported doing equity-based work in the community. So I'd like to start, and I will say I learned this from actually Dr. Uche Blackstock on Twitter. So we'll start with the land acknowledgement for the part of the country that we're going to be focusing on, or at least the origins. And that's the Caribbean, which were initially inhabited by the Taino tribes, mostly in Cuba, Jamaica, Hispaniola, and the Carib as well, which the Caribbean is named after. And I'd like to start at the beginning. I know we have a mix of people, and I'm very much a history and like to define things as we progress. So I wanted to start out by defining intersectionality, which is defined as a complex, cumulative way in which the effects of multiple forms of discrimination, which can include race, all the isms, racism, sexism, classism, how they combine, how they overlap, how they intersect, especially in the experiences of marginalized individuals and groups. So the Caribbean, which is our focus, well, we know where it's located, but it's quite diverse region of the world. There are multiple languages, 13 countries, 18 dependencies, more 11 plus ethnic groups, 13 languages, and it said several 11 plus languages, not just from who primarily inhabited or were brought there or raised there, but also the migration that has happened over time. All right, so brief snapshot of the history of when Christopher Columbus first, quote unquote, discovered the Spanish claiming the Caribbean, the slave trade following thereafter, the African slave trade with more European countries colonizing the Caribbean, the growth of several industries, including sugar, coffee, tobacco, the Haitian Revolution, which of course was the successful Black Revolution, the first Black Republic and the second free country in the Western Hemisphere. And I wanted to add in there also the Monroe Doctrine, which really kind of set a stage of how United States policy would have an impact on the Caribbean and Central and South America. And this has led to really a unique mixture of history and culture. And depending on what country, what ethnic group you are focusing on in the Caribbean, you have a varying mixture of these three groups, the Taino, the European, and the African. So whether you're colonized by English, England, Spanish, French, that mixture with obviously the African culture and Taino, you will see in varying degrees throughout the Caribbean. Which brings us to race and ethnicity, both of which are social constructs. Ethnicity being defined as of relating to large groups of people, classed according to common racial, national, tribal, religious, linguistic, or cultural origin or background. And then we'll see the racial composition between countries are quite variable. Again, race being a social construct, but being quite variable between the countries. So in Jamaica and Barbados, 90% will recognize themselves as of African descent, whereas Trinidad and Tobago and Guyana, over 50% will recognize themselves as South Asian or a mixed ethnicity. Despite this diversity between these countries, we see threads of commonality throughout. So there are few Caribbean where you can go where you will not have some sort of rice and peas and plantains and yam. Obviously, carnival is a big fixture of most of the Caribbean islands, and there's quite a bit of commonality between the culture and art. Sometimes it's hard to distinguish between cultures. So that brings us to here in the United States, the Caribbean population within the United States. And especially now as we're having we're rightly having the discussion on Black and ethnic racial disparities, the most common foreign-born Black population in this country come from the Caribbean. 1.7 million Caribbean born Black immigrants in the United States represent half of all Black immigrants in the country. And there's been a steady increase over time, interestingly, compared to perhaps other foreign-born Black populations. The majority of those originating from the Caribbean have settled in New York and Florida. And so we see the most common countries being Jamaica, Haiti, Trinidad, Dominican Republic. And it's interesting, this Dominican Republic, it is those who define themselves as Black. That's included as far as that population figure. And so the Caribbean here in central Brooklyn. So why is this especially important for us? Where we are located, central Brooklyn, 42% of the population are considered foreign-born. Most of the immigrants are from the Caribbean, with following the national trend, Jamaica, Haiti, Trinidad, Tobago, and Guyana being the most populous. And it's interesting because those countries then are mostly centered in New York and Florida, and then we happen to have where we are right now, a large concentration of that. And obviously we see evidence of that with the, a portion of Brooklyn being named Little Haiti. And then obviously we have the West Indian Day Parade celebration that occurs every year. And then we see the overall percent for Brooklyn and the table for the right of the foreign-born population within Brooklyn. So why is this important? Why the history, the politics, the culture, the everything? And it goes into this. Now we understand that health is not just a result of biomedical factors and strictly treating disease, but it is about the structural and social contributors that are affecting health. And this structural competency, which was developed by Dr. Metzel and his group, is for us to be able to understand the upstream contributors that are creating what happens when the patient walks into our door before they walk into the hospital. What are the policies, the economic system, the hierarchies like racism, discrimination that are contributing to the social determinants of health that are obviously leading to disparities in health outcomes? And I would add onto for our, immigrant community, another layer, specifically like the immigration policy, foreign policy, as we said. How does our policy in these other countries affect those communities? And history and culture, as we learned, is extremely important with the immigrant community, especially the Caribbean community. And again, if everybody on this I know knows why this is important, but again, if we want to address the racial disparities that we are facing, we have to look beyond the walls of the hospital into the community, the socioeconomic factors, the context of communities. And for our Caribbean community, for our immigrant community, there are some added layers to that. For instance, immigration-related barriers, cultural and language differences that are important if we want to have impactful interventions in those communities. And for the Afro-Caribbean immigrants, that intersectionality of the social injustice, systemic barriers to health and healthcare, not just here, but also abroad, are important, and the complex cultural identities of these immigrant groups, again, if we want to have impactful interventions in these communities. And so obviously we are a data-driven line of work and society. And so what does the data tell us about the Caribbean community and Caribbean women that we serve? So this is where things get a little bit difficult to draw on the differences. So the Black and African American population are aggregated for epidemiologic purposes. So it makes it difficult to sample specific communities. Relatively limited data on the subgroups, although the information on those subgroups are important, again, if we want to have understanding and be able to have impact in certain communities. And there was a task force report that quite frankly stated that racial categories are too broad to reflect accurately the disease profiles and prevalence of risk factors among subgroups of American Blacks. Having said that, I will try to just do an overview of what we do know about Caribbean-born health in the United States, trying to emphasize where there were specific as it relates to women, Caribbean women, and where there are some disparities. So this is actually from an AHRQ report, and where they started to look within the Black community to see if there were differences in subgroups. And so one of the things, I would say Caribbean-born Blacks have poorer self-rated health status, more activity limitation, and more hypertension-related activity compared to those born in Africa. But there is also, I just want to add on to that, that's compared to Africa, but there are a lot of studies that say compared to US-born Blacks that there is improved, better self-reported health status as compared to US-born Blacks. Mental health, Caribbean Black women had significantly lower odds than African-American women of suffering from any mental disorder. But what's interesting, as was pointed out, that Spanish-speaking countries had a higher odds of lifetime prevalence than English-speaking countries within the actual Caribbean. So we see some differences there. And as is talked about quite frequently with the immigrant paradox, we see some changes over time. So there's been some work looking at ancestry and change with generation, with exposure here in the United States. So with mental health, it was found that the third generation immigrants had greater odds of lifetime prevalence of any disorder as it relates to mental health. Also remarked that Haitian-born Blacks have lower rates overall. This is a general statement that was published, lower rates of cancer and low birth weight. But again, to point out how within subgroups there can be disparities, because this is a group of countries and ethnicities that are grouped together, and there will be differences within that group. For example, Haitian-born women have a higher rate of cervical cancer mortality compared to US-born Black women. So even though we may look at generalizable figures, it's important to look at disparities within subgroups. And that's what we do within equity, right? Focus on the most marginalized and see where there is a need. So looking to health disparities within the Caribbean, and I chose this hypertension because I felt that it demonstrated how socioeconomic factors are affecting this particular outcome. So in Latin America and the Caribbean, approximately 1/2 of those greater than 60 years are living with hypertension. Prevalence of hypertension is higher in Latin America and Caribbean compared to other geographic regions. And was an interesting finding are the comment on the socioeconomic contributions. For example, in Trinidad and Tobago, there was a noticeable decrease in the prevalence of hypertension as monthly household income increased in both sexes. Even more interesting was that was only statistically significant in women. So as women were able to have perhaps more autonomy, improved socioeconomic status, there was an improvement in the hypertension. And same thing to add on that, hypertension was also inversely associated with social capital. Again, this was only observed in women. So that makes this a little bit deeper dive into women in the Caribbean, originating women. There has been documented significance as it relates to gender and violence in this community. Half of Caribbean women surveyed and 5 Caribbean reported at least one form of violence in their lifetime. It was actually a campaign. I learned about this when preparing for this. Is called Caribbean Women Count, ending of violence against women and girls because of the prevalence rates of intimate partner violence in certain countries in the Caribbean, as listed there. And what are some of the contributing factors? Unequal power relations between women and men are considered to be a contributing factor. Another interesting finding, and this was actually in a study on specifically this intersectionality of Caribbean women's health, is that Caribbean women were found to be less likely to seek care compared to other groups, and that is a contributing factor. And there was also comment on the impact of COVID-19. So as COVID-19 is having a negative effect on the socioeconomic status and communities, and obviously with the state, those working and doing more from home, the effect that has on intimate partner violence. Going on another level, perceived discrimination and depression. Perceived discrimination was linked in this study examining perceived discrimination comparing Caribbean born individuals and African American, was linked to increased depressive symptoms, decreased self-esteem, and less satisfaction. And they found some interesting interactions between ethnicity, gender, and race. And so this graphic shows one example. So older Caribbean Black women exhibited higher depressive symptoms and lower life satisfaction in the context of high levels of perceived discrimination compared to African American males. Another level, again, going along with the discrimination, perceived discrimination, the stigma and discrimination that may have experienced by immigrant groups. For this, I would focus on one Caribbean country, Haiti, of which is to be my country of heritage, which has been particularly stigmatized over history, that has quite a significant effect. And these 2 images were 2 very distinct examples of the way this particular group has been stigmatized and discriminated against, which affects the distrust in all systems, not just healthcare systems, but all systems. One of which, the picture of the image on the left, is when Haitians protested against Haitians being listed as a risk factor for HIV/AIDS. That was actually here in Brooklyn. So that was done by the FDA. So obviously that is a federal institution. And then the image on the right is when the term boat people were popularized in relation to the immigration crisis coming out of Haiti. And these things, had significant effects, not just on perceived discrimination, but in the trust of systems. There's a short video that was constructed for another presentation, but I thought this kind of captured all the ways how immigration, trauma, and everything affects communities, especially immigrant communities. It's a 3-minute video, so I'm going to play.
Take care of patients of Haitian descent. It's important for us to understand the impact of trauma in the Haitian community. So having said that, what is trauma?
Trauma is very complex, but to sum it up, what I would say is that we have to consider trauma as very subjective, which means that everyone's experience is different and everyone's experience is valid. When we're talking about trauma, I like to use a ruler effect, right? We have numbers 1 to 12 in a ruler, and I like to say that numbers 1 to about 5 mean stress. So anyone who has experienced any kind of situation where they feel that they are extremely vulnerable and that they now see the world as dangerous, they would fall under the framework of 1 to 5, where they're experiencing extreme stress. What often happens now is that that person may not necessarily treat that stress, and then now they move into the other part of the ruler, maybe numbers 6 to about 8, where they're now experiencing distress. Distress means that that individual more than likely is traumatized. Now, over time, with even more lack of treatment, now that person experiences possibly a disorder where maybe they need to be diagnosed with PTSD.
How would you describe trauma in the Haitian context?
To illustrate trauma in the Haitian context, I would use a former patient, Marie. Marie's a 50-year-old female. She migrated to the United States at the age of 26. Prior to living in the US, in Haiti, she experienced multiple types of trauma, from abject poverty, political violence, community violence, child abuse, etc. Then she moves to the United States and then continues to experience different types of trauma. For example, the burdens of taking care of family back home, financial issues, immigration, etc. And her PCP noticed some symptoms in her. So some of her traumatic symptoms included backache, stomach ache, headaches. In addition to that, she had chronic illnesses such as high blood pressure, diabetes. And so when I treated her, some of the things that we used was narrative therapy. We used proverbs, which Haitian people love to use to express themselves. In addition to that, we connected to indigenous healing, such as herbal teas, massage, and all the other expressions and rituals that Haitian people use.
I'm gonna pause it there. The reason why, or I thought this was very helpful, is I really feel like can transcend to no matter which country or culture that you perhaps are speaking about, and what they may be facing in their home country, how the challenges here are affecting them, and the way that they use cultural humility, cultural understanding, trauma to be able to reach and treat that particular individual. And I save the best for last, not just because I'm biased to OB-GYN, but as we've been talking about maternal health disparities, all of these things that we've mentioned have impacted the disparities that we see in maternal health outcomes. That's racism, discrimination, barriers to care, effects of stress over our lifetime, everything. And when we talk about Caribbean women's health, unfortunately, we see some evidence of that, where obviously in New York City, unfortunately, Black women are 8 times more likely to suffer a pregnancy-related death. And when we look at severe maternal morbidity, which has been an often used measure, We see that actually here in New York City, it is the Black foreign-born community that are at the top of this list of as far as the risk of these pregnancy complications, the highest rates of severe maternal morbidity. And so understanding the context and understanding the best way to be able to engage and navigate those communities are going to be important to addressing. So when we look at the intersectionality and the levels of barriers of care, obviously race, ethnicity, gender, culture, history, class, politics all play a significant role. And when I try to conceptualize it in the layers that we see here within our community, obviously we have the race and the way that structural and interpersonal affects the community. We look at this foreign-born immigrant, even in ancestry, the differences in culture, et cetera, and how that affects the unfamiliarity of navigating systems, the distrust of the care, the distrust of systems, not just because of here, but also because of interactions, perhaps with the United States in their home countries, the impacts of lack of insurance benefits. And I think you think about COVID-19 and, for instance, the funding that has come out to support the country, a lot of the immigrant communities are not eligible for a lot of these benefits and were particularly impacted by these. And this last one, which was specifically for a previous presentation that I did specifically for Haiti, and I removed Haiti because, as I said, depending on the country or group that you are focusing on, they will have their own cultural and specific differences that need to be considered. The last thing I wanted to mention is obviously that this inequity is not just a United States phenomenon. This is a global phenomenon, the global system, the inequity in global systems and structures. And so even within other countries, you see gaps in health outcomes within countries. So based on socioeconomic status, based on class. So these inequities are not just here, not just by race, but it is also by socioeconomic systems in our global community. And to quote the World Health Organization, such trends within and between countries are unfair, unjust, and avoidable. Many health differences are caused by the decision-making processes, policies, social norms, and structures, which exist at all levels of society. And of course, adding the gender part of it and how that has an effect in the global community as well. And we're running out of time, so I'm not going to focus too much time on this, but I just wanted to show some of these disparities that exist on a global scale. And so, for example, in Haiti, let's say Haiti and Dominican Republic, the same island, maternal mortality ratio, to look at the difference, 359 compared to 92, and obviously 14 in the United States. So these disparities are global because of the structures and systems that we have in place globally. So to try to tie everything together. So first, obviously, if we talk about Caribbean and Caribbean woman, the colorful, complex, and diverse in race, ethnicity, history, socioeconomic, and all of those play a part into the daily life and their health. The aggregate data makes it harder. It diminishes the subgroup differences. So if you're serving that community, taking extra efforts to understand the disparities within that community is extremely important. Importance of racial ethnic concordance should think about sometimes that also goes beyond race and considering the ethnicity to work with a community. And obviously essential is cultural humility. So nobody is an expert in any one group or culture. I'm not an expert of my heritage. But understanding that somebody's culture, somebody's background is impacting their perception and their care, and having the willingness to be open and understand the best way to treat and interact is important. And thank you very much. And obviously an ode to one of our local legends from the Caribbean community. Thank you.
Thank you so much for a wonderful presentation, Dr. Pardo. That is amazing. And I already have people in the chat asking if they can have access to your presentation and just ways to reach out to you if they want to follow up with any questions.
Yes, and thank you to Dr. Boone Foster, yourself, the Office of Education, again, for the opportunity to give this talk. So anybody can feel free to reach out anytime.
Okay, great. So when we do write this up for the President's Bulletin, we'll just include your information for them to reach out to you for more information. Thank you again for taking the time to be with us today, Dr. Pardo, and wonderful presentation. So at this point, I would like to transition into our award ceremony. Dr. Boone Foster wanted to make a statement.
Yeah. So thank you so much, Dr. Pardo, for this very informative discussion. And please provide us with your slides. But I also wanted to take this opportunity to welcome one of my mentors and someone who taught me when I was a medical student, who introduced me to the field of pathology, and that is Dr. Carolyn Weber. Hi, Dr. Weber. So you were a faculty member when I was here from 1990 to 1994. So I don't know how many of you had the opportunity to work with Dr. Weber, but she's one of the faculty members that you can just go to with any questions, with any problems. And as a student of color, it was great to have Dr. Weber because she's someone you can look up to. You know, you can always go to her office and just, Dr. Weber. And she always had just a kind word, a supportive word to say. So I'm so glad to see you, Dr. Weber, and thank you so much for being part of this celebration of greatness.
Thank you very much. Of course, we pathologists were always there in the dark, and we always welcomed not just friends, but medical students as well, and with the American Medical Women's Association too. But my secret was that I'm married to Jerry Thompson, and Dr. Blackstock was an intern with twins, carrying twins, and she made it. So congratulations to all of you, and thank you.
Thank you, Dr. Weber.
Thank you so much. I know you spent a lot of your time at Downstate, and we benefited from it greatly. And I remember your favorite hobby of photography and how you used to take so many pictures and bring them to our office. So thank you so much for all of that.
Thank you. Not very good pictures, but I still
they
have
were
some
excellent.
really good ones.
Thank you. So at this time, I'd like to start off by congratulating all of our award winners. Each year, the Office of Diversity, Education, and Research has several categories where we select individuals who have shown dynamic work in diversity throughout the institution. We have our Dr. Dale Blackstock Award, our Diversity Champions Award, our Community Awards, Community Service Awards, our Outstanding Service Award, and our Excellence in Mentoring Awards. So these are people that have shown great dedication, commitment, and are people that are continually working to their highest potential to make sure that Downstate looks its best. So we're so happy to have all of these individuals with us. And we will start with the Dr. Dale Blackstock Award, which is usually given to a faculty member. And this year's awardee is Dr. Christina, who has done amazing work with our office for so many years. I know Dr. Hill would have been happy to be here as well. You know, during her time working at Downstate, you've done so many incredible things. Dr. Christina Kien is an assistant professor in pediatrics and serves as the program director for the pediatric residency program and director of community pediatrics. She graduated from SUNY Downstate's College of Medicine, where she stayed to complete her pediatric residency training. As a first-generation Dominican American, she initially thought she would return to her roots and serve in Washington Heights. During residency, she saw similarities with East Flatbush. Upon completing her residency, she became a faculty member and joined the Department of Pediatrics and called Downstate her home. She has dedicated her career to advocacy and addressing health disparities. Early in her career, she served as a child abuse specialist for SUNY Downstate's Medical Center, or Health Sciences University. When she became the program director, she created the Pediatric Community Advocacy Elective, as well as educational experiences that address health disparities. She is the co-recipient of the AAP Leonard P. Rome Catch Visiting Professorship Award. This award is given to pediatricians whose work promotes advocacy for children and advances the field of community pediatrics. In 2020, she was appointed to the GME, which is Graduate Medical Education Associate Designated Institutional Official of the Diversity and Inclusion sector, and serves as a faculty member of the Diversity, Equity, and Inclusion House Staff Council. She works closely with the Office of Diversity, Education, and Research and serves as the co-chair for the Health Equity and Social Justice Work Group. She enjoys mentoring medical students and residents. Dr. Guillen is a Harvard Macy Institute scholar who is currently working on a project to create a health disparities curriculum for residents and fellows that will be implemented at SUNY Downstate Health Sciences University. So at this time, I want to congratulate Dr. Guillen for being the recipient of our Dr. Dale Blackstock Award.
Thank you, Anika. Thank you, everyone. I'm like looking at the chat box blowing up. Thank you so much. So good afternoon, everyone. I would like to thank Dr. Anika Daniels-Azaze and Dr. Carla Wooten-Foster and the entire Office of Diversity Education Research for this prestigious award. I am truly honored and humbled to receive the Dr. Dale Blackstock Award. Dr. Blackstock is an inspiration to all women, especially Black women in medicine. She inspires all of us because despite the many obstacles she had in her life, she overcame them and succeeded to become determined and passionate with her field and everything she does. And she is triple boarded. So I know I did a lot of Google search about her in internal medicine, nephrology, and geriatrics. So God bless her. When she broke the glass ceiling, she never forgot the importance of paying it forward, mentoring students, serving as a role model, and most importantly, serving her community, which is this community. Although Dr. Blackstock left us too soon, she left us with her legacies, her beautiful daughters, Oni and Uchi. And these amazing women follow their mother's path to become physicians and leaders. And they are trailblazers in the work that they do. And as a fellow Black physician, I am so proud of them, and I will be following you. I know that your mother is so proud of you in heaven, especially on this day. I know Oni, you had shared that it's her birthday, so both of you give her gifts every day. Again, I am honored to receive the Dr. Dale Blackstock Award, and I would like to congratulate all the awardees that are sharing this day with me and receiving their awards. So thank you.
Thank you so much, Dr. Guillen. And now we would like to present our Diversity Champions Award to Dr. Shirley Gerard. Dr. Gerard is a co-director of the Brooklyn Initiative to Develop Geriatric Education, voluntary professor in the College of Nursing at SUNY Downstate, and a health policy consultant to the Council of State Governments on the East. During the preceding 5 years, she served as the Associate Dean for Research and Community Partnership in the College of Nursing. She is committed to improving health and healthcare and promoting social justice and equity through her roles as nurse, educator, analyst, researcher, and advocate. She holds a PhD in health and social policy from the Heller School, Brandeis University in Waltham, Massachusetts, a Master of Science in Nursing from Yale University in Connecticut, a Master of Arts in Medical Sociology from University of Connecticut, and a Bachelor of Arts with a major in sociology from Eastern Connecticut State University, and a diploma in nursing from Hartford Hospital School of Nursing in Connecticut. As you can see, she's a lifelong learner and loves education. Dr. Gerard's personal career has included clinical practice in a variety of settings, including an advanced practice nurse. She has held positions in philanthropy, public service, elected and appointed, management and administration in professional organizations, healthcare and education, and serving on national, state, and local committees. Her research has focused on the nursing workforce evaluation, public policy, and nursing education through publications, grantsmanship, service on several editorial boards, and professional speaking. At this time, I'd like to congratulate Dr. Gerard, who is very distinguished in her educational career, for the Diversity Champions Award.
Thank you so much. I am really honored and humbled to be recognized for this award. it means a good deal to me for a variety of reasons. As a nurse, also as a member of the Downstate community, where I think we often struggle to try to address what is right and important in the world, and to be among this esteemed group of honorees really is very humbling to me, because what I've done and what I do is only because of the people that I work with, including my colleagues at Downstate, who value the things that are really most important to the world, and that is us as human beings, and to bring that humanity to everything we do, whether it's research, patient care, policy, advocacy, I think is so incredibly important. So to be among this group of awardees, whom I congratulate as well, and to keep up the incredible work that all of you and so many people at Downstate do to seek health and social justice for everyone. Thank you.
Thank you so much, Dr. Gerard, and congratulations again. Next, our second recipient of the Diversity Champions Award is Nkiruku, known affectionately as Kiki Nwoke. She is the administrator of the Department of Family and Community Medicine and an 18-year resident of Flatbush, Brooklyn. In her 7 years at Downstate, she has taken part in numerous care transformation projects, including patient-centered medical home recognition, integration of behavioral health and primary care, and implementation of value-based and quality initiatives. Kiki was also a senior project manager of the Downstate-led Brooklyn Healthcare Improvement Project, which brought together local hospitals, government insurance plans, and community organizations to assess and make recommendations regarding avoidable emergency department hospital use and chronic conditions hotspots in northern and central Brooklyn. For the past 3 years, in conjunction with the local nonprofit CAMBA, she has organized the Phenomenal Girls Symposium at SUNY Downstate, which provides empowerment workshops for girls aged 12 to 18 for our local community. Kiki also works in collaboration with Downstate's OBGYN department and other Downstate divisions to promote maternal and child health initiatives. Her passion is collaborating with community organizations, and she co-teaches a class in the family medicine clerkship program on how providers can address social determinants of health. She is a graduate of Columbia College and Yale Law School and worked in corporate law and consulting prior to Downstate. And what I've also been told about Kiki is that she tirelessly helped the community during COVID to feed all of the essential workers and gave out over 10,000 meals to people at Downstate. So that in itself is a great commitment to the hard work and just all the challenges we had or we continue to have with COVID and what she's done for our community. So at this time, I'd like to congratulate and welcome Kiki Nwoke.
Hi, thank you so much. I'm definitely privileged and honored to receive this award. I love working here at Downstate, and I'm so impressed with my colleagues. I'm just, I know we're short of time, but just grateful to be receiving this and working together with everybody to make our community a better place. Thanks.
Thank you so much. And now we move to the category of excellence in mentoring. Dr. Laura Martello-Rooney is a research assistant professor of medicine in the Division of Gastroenterology and Hepatology at SUNY Downstate. She received her PhD from Albert Einstein College of Medicine under the mentorship of Dr. Susan Horowitz. Her thesis research focused on a study of new natural products with a similar mechanism of action as paclitaxel and with anti-cancer activity in lung cancer. She did a postdoctorate fellowship with Dr. Angel Pellicer at New York University School of Medicine, where she examined the role of novel oncogene from the RAS superfamily in T-cell leukemias and lymphomas. In 2019, she joined SUNY Downstate as the director of GI research and began building a translational research program around the study of pancreatic cancer, including disease pathogenesis, and a new drug delivery system for local release in pancreatic tumors. Dr. Martello-Rooney also has been overseeing the activities of the recent NIH P20 grant partnership with Stony Brook University and Cold Spring Harbor Laboratory, including pilot projects on colon and pancreatic cancer disparities, establishing the GI Cancer Biobank in collaboration with the Department of Pathology, mentoring 2 graduate students, and organizing the annual Cancer Health Disparities Symposium. In addition, she has mentored numerous GI fellows, medicine residents, medical students, and undergraduate students on GI-related research projects, and has 2 new graduate students in the lab to continue working on these pilot projects. She's also been instrumental in serving as a mentor for our summer research program in the Office of Diversity, Education, and Research. So this time I'd like to thank and congratulate and welcome Dr. Laura Matella-Rooney.
Thank you very much. I want to thank your office and especially Dr. Daniel Osaze for organizing this wonderful event, and Dr. Booten Foster, who's been there supporting our cancer disparities research and our symposium that's taken place. I'm honored to receive this award, and congratulations to my fellow awardees. Just want to thank my family and especially my PhD mentor, who set a really good example for me as to how to be a good mentor. And so I'm thankful that she continues to advise me even in her retirement. And I hope I can continue to be a strong force here at Downstate to continue mentoring the next generation of cancer scientists. Thank you.
Thank you so much, Dr. Matella-Rooney. And now next in this category, we have Dr. Simone Reynolds. Dr. Reynolds is an assistant professor in the Department of Epidemiology and Biostatistics in the School of Public Health at Downstate. She graduated from Randolph-Macon Women's College, New York Medical College School of Public Health with an MPH in epidemiology, and the University of Pittsburgh Graduate School of Public Health with a PhD in perinatal epidemiology. In her role at the School of Public Health, Dr. Reynolds has taught the traditional courses, Principles of Epidemiology, the 2 methods courses, Epidemiological Research Methods 1 and 2, and the master's and doctoral levels. Dr. Reynolds is also an early innovator in the art of online teaching and is currently championing the School of Public Health online initiative towards a fully online MPH program. Aside from her teaching, Dr. Reynolds has also established a solid track record of mentorship since joining the School of Public Health faculty in 2012. At this time, I'd like to welcome Dr. Simone Reynolds, who is the recipient of the Excellence in Mentoring Award.
Thank you very much. To be considered for an Excellence in Teaching Award is a great honor and privilege. I want to congratulate my fellow awardees, and I want to give a special thanks to Dr. Daniel Osaze and Dr. Booten Foster, as well as the Diversity Education and Office of Diversity Education and Research. It is very humbling to also have my name associated with the great Dr. Dale Blackstock, given her legacy of reducing health disparities in our communities, and including her daughters who are also continuing that legacy. I also want to acknowledge the supportive environment of the administration of the School of Public Health, Dr. Denisi, or previous Dean, Dr. Pardo, our wonderful faculty, staff, and students. And that environment has created a catalyst for me to grow as a junior faculty. I also want to recognize mentors on my life journey. My very first mentors, of course, were my parents, who started out their careers as teachers. But I want to recognize my high school biology teacher. She may never see this, but Miss Arlene Walker, when I left Jamaica to come here as an 18-year-old to enroll in Randolph-Macon Women's College in Virginia, that transition was a big deal for me. And she hand wrote me letters regularly. It was wonderful to have that level of support from a teacher who believed in my potential. I also want to acknowledge my doctoral mentors during my PhD, Dr. Janet Katov and Dr. Jim Roberts, and then Dr. Michael Joseph, who has been a perfect role model and mentor here at Downstate, who I strive to emulate daily in my interactions with our Downstate faculty as well as student body. I've been always fortunate to always have a mentor along my life journey, and so it's an absolute honor to be recognized in this manner. And last but not least, I have to acknowledge my cheering squad, my husband, Wadsworth, and our children. And this award serves as a major encouragement for me to continue in the footsteps of my mentors as I work to mentor the next generation of the public health workforce equipped to reduce health disparities in our communities. Thank you very much.
Thank you so much, Dr. Reynolds, and congratulations again.
Thank you.
Our next category is Outstanding Service Award. And our first recipient is Ms. Lori Ann, also known as Lori Bradford. Lori currently serves as the Sponsored Programs Associate in our Research Foundation, or served in our Research Administration Pre-Award Office. She joined the Downstate team in April 2015 and has been a tremendous resource. She has over 8 years of experience working with grants management and submissions. In her current role, she is responsible for the support, submission, administration, and organization of a wide variety of tasks related to grant management and submissions, including the development of tools to assist faculty and administrators. In this role, she serves as one of the authorized officials on behalf of the institution and has an in-depth expertise of sponsored regulations and logistics surrounding complex grant proposals. Prior to joining Downstate, Lori worked as the grant administrator for a very well-funded center at Columbia University Medical Center. She is extremely customer-oriented, friendly, and knowledgeable in research administration. She continues to demonstrate strong communication skills by creating and maintaining trustworthy relationships with faculty, administrators, students, and colleagues. And I guarantee if any of you have done any grant writing for the institution, you have had contact with Lori, and she has been instrumental in getting your paperwork in on time and correctly to make sure that you get funded. So at this time, I'd like to say thank you and congratulations to Lori, Ms. Lori Bradford, for the Outstanding Service Award, and to welcome her.
Hi, everyone. I just want to say that I'm extremely grateful for the recognition. I've learned so much in my 6 years here, and it's such a pleasure to work with all of our researchers and their teams, including the Office of Diversity, Education, and Research. I also just want to take this time to congratulate all the other awardees. Thank you.
Thank you so much.
Oh, sorry. And I just wanted to add that Lorian is just a wonderful person to work with on campus and off campus. So quickly, a quick story. I don't know if you remember this, Lorian. So this was back in the day when we were able to share Ubers. So I got in an Uber, and then Lorian gets in, and I recognized her, but she didn't recognize me. And I said, "Oh, driver, please don't stop for her. Anyone but her. Please keep going. I can't ride with her." Lorian was just so calm. She was like, "I'm sorry." And I'm like, "Not her, please, just keep going." And she's like, I'm so sorry. And then she looked and she saw it was me, but she maintains her decor, her professionalism in the car. And it was just a very nice ride. And I'm sorry, I know I stressed, I kind of stressed you out that day, but I just want to let everyone know that the professionalism that you see in the office is the professionalism that you see in the community. So thank you, Lori.
Thank you.
Thank you, Dr. Boone-Foster. And congratulations, Lori. The next person in our category is Ms. Carol Martin. Ms. Carol Martin was born in the island of Grenada on September 23rd, 1975, to a single mother, and she is the sixth of 8 children. She attended Hunter College as a pre-med student, but later decided that nursing was what she desired. Carol then left Hunter College with 116 credits and headed to New York College of Technology, where she obtained her associate's degree in nursing. During her last year of nursing school in 2001, Carol came to Downstate and worked as a student nurse intern, where she gained her experience and made a commitment to Ms. Brown, the former nurse recruiter, that would remain at Downstate after she passed her state board's examination. It was on nursing station 81 during the night shift when Carol realized that she passed her boards and was hired on that unit for 5 years before being transferred to recovery room. Her desire to learn and grow intrigued her curiosity for knowledge as she then transferred to pediatrics and was cross-trained in maternity and NICU. After another 5 years of learning in that patient population, Carol decided to return to Nursing Station 81, the CPCU step-down unit. Carol obtained her bachelor's in nursing through Chamberlain University and soon obtained her master's degree as a nurse educator with Dr. Sarah Marshall as her mentor and preceptor. Carol is presently attending Chamberlain University and expects to graduate with her doctorate in nursing. And again, this was supposed to be last year's event, so by now I'm assuming she has graduated with her doctorate in nursing in nurse practice. She also works as an adjunct professor at various colleges in New York. She presently works in the Student and Employee Health Services and integrates her passion for education as she often helps to guide students educationally. Carol is a wife and mother of 3 beautiful and energetic girls. She believes that without God, none of this would be possible and gives thanks for those who he has put in her life. Carol looks forward to giving back to the nursing profession by getting more involved in educating nursing students and advancing the nursing profession. What I can say about Ms. Carol Martin is that working in her environment is very challenging. If any of you have been to Student Employee Health, you will see it's always busy, it's always buzzing, there's always work to be done, and never have I ever seen her leave early. If anything, she's probably worked extremely late to try to make sure that every person and every patient that is in that room has been taken care of and has been serviced. And when we have our summer programs, we normally have to process over 100 to 150 students to get the medical clearance to be able to do our pipeline initiatives. And she works tirelessly to help us get that done. So I would like to say thank you to Ms. Carol Martin and to present her with the Outstanding Service Award and introduce her to everyone today. Ms. Martin.
Hello, good afternoon to the Downstate community. I want to thank God for being here and to the individual and the individuals who nominated me for the Dr. Dale Blackstock Award. I am truly honored. Dr. Blackstock was instrumental in advancing health equality and preventing biases, racism, and in healthcare. I too believe that if we stand up against racism and the isms and stand up for the voiceless, then the world and would be a better place for the human race. So thank you. I am indeed honored and privileged. I did graduate past December with my doctoral degree. So thank you everyone for this honor. I appreciate it.
Congratulations, wonderful.
Thank you.
Now we will be calling you Dr. Carol Martin. So
yes.
Congratulations, Dr. Carol Martin.
Thank you very much. Thank you, everyone.
Okay. And now for our next person in the same outstanding service category, we have Ms. Taryn Toval-Turpin. Ms. Toval-Turpin is the Director of Special Projects, where she has taken on the role of project managing the LCME accreditation process for the College of Medicine. Prior to this, she was the Assistant Director of Assessment for Downstate's Office of Medical Education and Senior Research Analyst for the Office of Institutional Research. Taryn worked in institutional research for over a decade and specializes in research and data analysis. Her foundation in research methodology stems from her undergraduate degree in biology and psychology from Wake Forest University and a master's degree in applied social research from CUNY Queens College. In her early career, Taryn worked for a biotechnology company on regulatory submissions for phase 2 and phase 3 clinical trials and presentations for potential licensing agreements. In addition to being a driven professional, Taryn is a loving wife and mother of 2 energetic and curious boys. She is heavily involved in leading small groups at her local church. Her love of culture and learning is nurtured by international trips with her family and engaging in social events. And now if any one of you had anything to do with the LCME for the College of Medicine, you can only imagine the work it took to get that done. It was a 3-year process that was very time consuming, very data intensive. And Taryn was instrumental in making sure that we were all on point and had our data and that we were on time for our meetings. And Dr. Bloom-Foster, I think you wanted to add something.
No, I was going to invite either Drs. Volkert or Lazar if they wanted to say anything, because they, I don't think they slept for about 2 years with this process. So I wanted to open the floor if they wanted to share anything, share with Taryn.
I'd be happy to say a word. LCME self-study and the survey success that we had would not have happened without Taryn. She was utterly central to the entire project, and indeed, when we got into meetings, and I would frequently say that Taryn was actually my brain in this process. I don't know how it would have ever happened without it. I thank her very deeply for it.
I would like to echo Fred's comments. I want to say that without Taryn's involvement, we could not have done it. She was extraordinary. She not only learned a lot, but she taught us what she learned. She was incredibly invaluable, and probably even more important, she was just a delight and a pleasure to work with. On behalf of Dean Buonicardi and myself and the entire steering committee for the LCME, we are delighted that she is being recognized today, and we are grateful for such a lovely ceremony, and we can't think of anybody more deserving. So thank you very much.
Thank you so much. And now I'd like to welcome Taryn.
Good afternoon, everyone. I'm honored and humbled to receive this award. I'm thankful to the Office of Diversity, Dr. Buchan Foster, Dr. Daniels Osaze, and everyone in that department for this recognition. I think I'm thankful for the examples of dedication shown by the education leadership team and the members of the LCME steering committee. And to my unsung colleagues in the Office of Medical Education, I thank you so much for your encouragement and motivating me to be my best. I enjoy working with all of you so much. And a special thank you to my family, especially my husband and kids who endured long hours of LCME self-study. I love you. And I thank everyone. Congratulations.
Thank you so much, and congratulations, Taryn. At this time, I would like to invite Dr. Pam Straker to provide the Outstanding Service and Community Award to Ms. Chandra Chapman.
Okay, Dr. Daniels will read Sandra's credentials, and then I'll be happy to make my comments.
Okay, so Ms. Sandra Chapman has nearly 3 decades of experience as a manager, problem solver, and advocate in the public sector, with special emphasis on streamlining services between a busy city agency and its residents. In her recent position as Chief Program Officer for Brooklyn Borough President Eric Adams, from which she retired in January 2020, Ms. Chapman was responsible for planning and directing programs and initiatives that serve Brooklyn's diverse communities and enhance the quality of life for all residents. Along with fostering relationships between the Brooklyn Borough President's Office and appropriate agencies and organizations, Ms. Chapman kept the Borough President apprised of developing and ongoing incidents throughout Brooklyn and works with him to resolve issues that affect our communities. As the Chief Advocate in Constituent Services, Ms. Chapman was uniquely qualified to assess our residents' needs and to help them navigate the often complex workings of various city agencies, from housing issues to transportation concerns and everything in between. Ms. Chapman previously served as Deputy Borough President under the former Brooklyn Borough President Marty Markowitz. Prior to her appointment as Deputy Borough President, Ms. Chapman served as Director of the Borough President's Community Service Center. Long dedicated to serving others, Ms. Chapman built a team committed to helping residents struggling to access city services, and until January 2020, she continued to supervise the center. Her far-reaching experience with the Office of the Borough President also included 4 years as a senior planner, during which time her understanding of land use, real estate, and the disposition of city properties was an indispensable asset to both the office and residents at large. Ms. Chapman has been the recipient of various community and public service awards, and she lives in Brooklyn's Canarsie neighborhood and is married with 2 children. At this time, I'll turn it over to Dr. Pamela Stryker, who will present the Community Service Award to Ms. Sandra Chapman.
Well, I'd like to thank all of you for allowing me to speak about Sandra. Sandra is just an incredible person. As we know, serving Downstate in its community, the community is the bedrock for us. Sandra is really someone who represents the community in a way that it's hard to describe, but I'll give you an example. I've known Sandra for a very long time, and I can say that I am old enough to have been here since Marty Markowitz was the borough president. But I got to know Sandra much better. Sandra served on the executive committee of the Brooklyn Health Disparities Center, and during that time we had the storm Sandy, and what I was struck by was her focus on really assuring the people in Canarsie that they could recover from this storm, even during a time when she was experiencing flooding. She is an absolutely sincere, dedicated, warm, and I'm going to say loving because she loves the community. And we were very, very sad when she had to leave, though I was, very happy for her that she was going on to do those things that she needed to do in her life. So I just want to say, on behalf of Brooklyn Health Disparities Center, and on my behalf, thank you so much, Sandra, and thank goodness we've maintained our friendship beyond Brooklyn Health Disparities Center, and I'm just looking forward to those things she will achieve in the years to come.
Ms. Chapman, we'd like to introduce you and bring you to the front stage if you'd like to say anything.
Thank you, Dr. Daniels and Dr. Stryker. Dr. Stryker, as always, I love working with you, and the feeling is mutual. A big thank you to President Riley, board members, faculty, and staff of SUNY Downstate and its Office of Diversity, Education, and Research. I can't go on without recognizing my dear family who are on the Zoom today and numerous friends. Thank you for all of your support. I can't call all of your names because I've seen that it's quite a few of you on there. But thank you for coming on during your busy schedule. A pleasant good afternoon to everyone. I'd like to begin by congratulating the family of Dr. Dale Blackstock and today's honorees. I am honored and privileged to be here with you powerful and phenomenal women. Again, I'm thankful to be selected to receive the Community Service Award. I have worked as an advocate in the public sector with special emphasis on planning and directing programs and initiatives, as you've heard, that serve Brooklyn's diverse and underserved communities. As Deputy Borough President, I work to resolve issues that affect our communities and on projects that uplift their quality of life, such as health and financial education. I really enjoy developing programs that help our residents navigate the complex workings of various city agencies. And I especially love planning cultural diversity programs, directing donations to the homeless population, such as thousands of new books to enhance children's imagination and presenting them with warm pajamas. The community and service public service awards that I have received, such as this one, underscores my commitment to community service. Some of the boards that I serve on include the Brooklyn Historical Society and the Brooklyn, as you heard from Dr. Stryker, being on the executive board of the Brooklyn Health Disparities Center. These boards are central to uplifting our borough. The Brooklyn Health Disparities Center, under the leadership of Dr. Mauro Salafu, is committed to reducing health disparities and promoting healthy lifestyles by conducting research and holding forums that about the impact of chronic diseases on our community. I commend Dr. Salafu and Dr. Straker and the center for making sure the community is engaged in the conversation around the current vaccine, sharing resources with executives at Downstate, medical professions, and residents at large. I love being able to witness organizations doing phenomenal work. I often wonder how they do so much with such limited funding, and I'm very much in awe of their generosity and their tireless resolve to improve our communities. It is an honor for me. It was an honor for me to support the work of many community organizations who are passionate about uplifting and improving our communities. I recently transitioned, as you heard, into a new life where I will continue to help build networks and introduce some of the programs and initiatives that I have built during my tenure in Brooklyn. I see so many new opportunities to continue the programs that I've developed. I don't want to take a whole lot more of your time, I know, because everyone has to go back to work, but I just want to say again, I thank everyone for their hard work and dedication and for discussing and amplifying the message around diversity and racial equities. Enjoy the rest of the program and stay safe. Thank you for this award.
Thank you so much, Ms. Chapman, and congratulations. I'm sorry.
Thank you.
Dr. Daniels, I just want to add to the discussion that we are also led by Dr. Marilyn Frazier. And so I did not want us to leave this presentation without having everyone know that the Brooklyn Health Disparities Center is also led by Dr. Frazier. So we all are very, very thankful for Sandra's work. And again, we will keep in touch.
Yes, thank you, and have a good day, everyone.
Thank you so much. And now I'd like to try to get a picture of all of the awardees. This is something new for me on Zoom. I'd like to try to do a spotlight of all of you. So if all of the awardees can be on camera, I'm going to try to pin you all to the first page if possible. So please bear with me as I make this unusual attempt. Congratulations again to everyone, and thank you so much. I want to say thank you to my staff for helping me get this all together. Dr. Booten Foster, thank you for your leadership. Thank you to Ms. Shamika Bowman, Ms. Tina Ajay Bosampem, Mr. Renako Goldstone for always supporting all the work that I do. Thank you to all of the award recipients, and thank you to the participants and our speaker today, Dr. Christina Pardo, for a fabulous lecture. And I hope everyone had a fabulous time. I look forward to seeing you again face to face and to be able to continue this legacy. And we will have this event again next year. Any parting words, Dr. Booten Foster?
Thank you.
Okay, and also thank you to the Blackstock family, Uche and Oni Blackstock, for being with us and supporting us as always. Have a wonderful afternoon, everyone, and I look forward to seeing you again soon.
Bye, everyone. Thank you.
Take care.